Obviously, I did, when I had a chat a little bit earlier in the programme to the Health Secretary Sajid Javid, talk a bit about, well, not a bit, a fair chunk about the tragedy in Ukraine. But I began by asking him about the release of Nazanin Zaghari-Ratcliffe. And I wanted to ask him how the government, Liz Truss, the Foreign Secretary, could be certain that that £400 million of debt that we've repaid to Iran would not be used to finance terrorism.
Well, I agree. It's fantastic news, and it's great to have this at a time where there's so much bad stuff around. But it's also an opportunity just to think back to how Nazanin and Anousheh, how they dealt with so many years of captivity, and to salute their resilience and their determination.
We have handed over almost £400 million. Liz Truss says she's confident that it won't be used for terrorism or for bad things. But how can we be confident? I mean, you're an economist. You know that if you give a country money for one thing, it just frees up resources for something else.
The money you refer to, the £400 million, first of all, it's a legitimate debt. It was something that we had long said for many years that we accepted we owed that money to Iran and we would find a way to pay it. It was right that we find a way that is compatible not just with UK law, but international law and certainly international sanctions. And that's exactly what's been done. Now, we don't know the details. They're not public on exactly how that has been done. But it's also been done in a way...
You're hopeful that this is not financing terrorism?
It won't be. It won't be, because we would never allow that. And I am certain that the funding can only be spent on humanitarian aid or humanitarian purchases. And I'm sure there are many ways to do that.
Now, just on a related issue, I mean, there is some hope in some quarters that we'll inch back to a nuclear deal with Iran. Do you think there's any chance, if that happens, that we'll be getting more oil into the West from Iran at a time when obviously we can't buy Russian oil?
No one really knows yet, but you're referring, I think, to the so-called sort of JCPOA, this deal that's been around for a while now, and the US had pulled out, and since then it's been in trouble. It's right that we try to get it back on track. The UK is working with our partners, particularly France and Germany, and now the US administration to try and do that. Let's see what happens. I don't want to jump to any conclusions. I think it's important to stay engaged with Iran, especially on such important matters as nuclear matters, but as of today, when it comes to Iran, it's great to see that these people have they've finally been released, Nazanin and Anousheh, and they're coming back home. So
I've got much more from my interview with the Health Secretary in just a moment or two, so, don't go away because you won't want to miss that. I'll also be talking to our former National Security Advisor, Kim Darroch, about how governments decide which dictators are the right dictators to do business with. See you in a minute. Welcome back. Now, we're just going to go to Hannah and Screeney first before we return to my Sajid Javid interview.
Thanks, Robert. Yes, you've just been hearing from Sajid Javid, and there is absolutely no doubt that this government has been prioritising money for the NHS. If we take a look here at the budget changes that were announced last October, the budget for the Department of Health and Social Care went up by a massive £20 billion over 3 years, thanks largely to the planned rise in national insurance from next month. To put that in context, education got an extra £4.8 billion, justice got just one, and defence, in fact, saw its budget fall. But over here at DHSC, that doesn't mean that everything is rosy. More than 6 million people are right now on the waiting list for NHS treatment. And this graph from the Institute for Fiscal Studies shows what could happen next. They reckon that waiting lists will keep rising throughout the next 2 years to almost 10 million by January 2024. That's almost a fifth of the population. And if that many people are waiting, then all of us are going to know someone who is on that list. And if that's starting to sound like a bit of a headache, then just wait for this. The government has promised to give NHS workers a pay rise this year, but a 5% rise below current inflation would cost around £4 billion a year, eating up a quarter of that huge rise in the NHS budget that we mentioned before. If there is no pay rise or a smaller pay rise, that obviously amounts to a real terms pay cut. I'm glad I'm not the one making the decision. Robert.
Thanks very much. And actually, the important point is if they actually put up pay by more than inflation, that is far less money for trying to tackle that waiting list problem that you've been referring to. And that was, of course, the question that I wanted answered by the Health Secretary.
No, I don't think. I've got no reason to think that at this point in time. Of course, I don't know, like anyone, what the inflation, what it actually is going to be this year. But you're right to suggest that inflation is
quite a big headache for everybody, including you.
It's higher than people would have anticipated even a year ago. We know why that is. We can see that, whether it's energy prices, other prices. But in terms of the NHS settlement,
and how much it's undermining it.
There's a record settlement. I mean, I made this big speech last week on my vision for the NHS, and one of the things that I pointed out in that settlement is that the budget for the NHS this year is bigger than the GDP of Greece. And so it's the biggest spending department. And, having also run the department that allocates spending, I know just how important it is to make the most of the money that we've got. And I think with some of the changes we're bringing in to the NHS, and that was the other thing I focused on my speech last week about some of the, not just the short-term, but the longer-term changes we need, I think we can, in the NHS, deliver a lot more with the money that we've got.
And I want to talk to you about that in just a moment. But just while we're on this issue of inflation, can you give any comfort to, for example, nurses and healthcare workers that their pay will keep in line with inflation?
Well, I'm not going to predetermine where we end up with nurses' pay or any other public sector pay this year. We do have a process. I think it's a very sensible, fair process, which is we have an independent pay review body, so that applies to nurses' pay, and they will set out what they think later this year, and I'll wait for that outcome.
But just to be clear, you're not denying that if you are told you've got to increase their pay in line with inflation, that will mean hard cash not available, for example, treatments in the NHS?
No, we take the remit seriously, and of course every sort of extra percent that we might give on pay, then that money has to come from somewhere in the NHS budget. But it's something that I've anticipated, and I'm sure that we can get it right.
Now, in terms of the reforms that you are planning, a big chunk is about helping us to keep healthier, detecting illnesses earlier. Obviously, that would, over time, reduce pressure on health service costs because treating somebody who's acutely ill is so expensive. But how long is it going to take for that to have a meaningful impact on the efficiency of the health service? Well,
you talk about the prevention work that we're doing, and it depends which aspect we're talking about. So let me give you an example. We've been trialling new ways to test people for cancer, lung cancer. And we've got these basically they're called lung cancer health check trucks. We've piloted them in places like Blackpool. And what we found is that the detection rate of lung cancer within 6 months, we found that it's jumped from 30% to 80%. And that's a very quick gain in 6 months. And things like that, we can make a big jump in early detection, early diagnosis, which means that we can prevent cancer from becoming very serious in a much better way than we're doing in the past. Other things will take time. So trying to get people to stop smoking, trying to maybe eat more healthier. This will take time, but it's important that we spend more time and effort on prevention because when you look at the NHS and what it does in terms of its elective procedures, its surgeries, some 40% of that, roughly, is spent on preventable diseases. So there's some short-term gains we can make, but also we need to plan for the long term. Now, the COVID survey shows that COVID is on the rise again. At the moment, you're only planning to give fourth jabs to those over 75 and those who are clinically vulnerable. Do you have any plans to widen the number of people who can get fourth jabs? Well, when it comes to vaccinations, I think we rightly take the advice of our expert clinicians. There's a committee, it's called the JCVI, and we listen very carefully to what they've got to say. And I would say, if you look at where we are again today, the most open country in Europe, the advice that we have received as ministers, I think, has been good, sensible advice. We've been right to accept it every time. They look at the data very, very carefully, and their latest advice, as you say, is that there should be a second boost, or let's call it a fourth dose, but to focus on those over 75, those in care homes, those who are immunosuppressed. Now, we will start that by the end of this month. That's what we've said, and we're completely on track for that. But We listen to their advice all the time.
So is
Should they come
it
forward?
possible they'll come forward, therefore, and say, we need more people jabbed?
I think at some point they will, and they've actually been clear in their most recent advices that they think that towards the end of this year, maybe in the autumn, there will be a need to give a lot more people a boost, an offer of a boost, but I'll wait for
Probably not till the autumn, OK. And then, finally, a couple of questions on Ukraine. You know, we were all incredibly relieved that we took into the UK 21 children who are suffering from cancer. Have you got more plans to help, you know, ill people in Ukraine? They might not just be children.
No, we will do everything that we can to help Ukraine and its people. And that includes, of course, our humanitarian response. I'm pleased in terms of humanitarian aid. I think at £400 million so far is more than any other country bilaterally. When it comes to health support, I was so pleased that we were able to take these 21 very ill children in with their families. If there is a need to take in more, of course we would look to do that and be as supportive as we can. Earlier today, I spoke to the Polish health minister, and we've worked very closely with the Polish government on this, and we talked about the possibility of taking more, and we remain very open to that. Alongside this, we've also so far had 9 flights of medical equipment and medicines that we send, and we will keep sending more for as long as necessary.
And under the refugee schemes, does every Ukrainian who comes to the UK under one of those schemes get total free access to the NHS as soon as they arrive?
Yes. Yes, it's absolutely right, and that's exactly what will happen. And in fact, we will make sure that they're offered upon arrival, you know, soon after a vaccine, a COVID-19 vaccine. The vaccination rate in Ukraine, I understand, is around 1/3 of the population, so a lot less than ours, but also any other kind of important medical screening.
And they'll have immediate access to a GP.
They will have access to the local GPs, just like you and I. They will have access to local schools, and I think it's really important that we give people from Ukraine, our friends, the warmest, most generous possible welcome. That's the kind of country we are, and that's what the British people want to see.
No, I'm sure that's absolutely right. It does of course, mean that the pressure on the NHS isn't going to get any less, though, doesn't it?
Look, it's no one can deny when you have, certainly, especially if it's tens of thousands of refugees, there will be more pressure on public services. But look, as a country, look, we're one of the richest countries in the world. We've got challenges, but look at the challenges of the people in Ukraine. Ours pale away in comparison, and you know, the British people are behind this.
No, as I'm sure you'll... I'm sure most people watching will say that is indeed the price worth paying. Very good to
Thank you.
see you, Health Secretary. Come back soon.
Thank you very much.